growth reflects the well-being of an individual child. It also reflects how a population is doing, because it's very clear that from societal studies that where there's been poor facilities, poor nutrition, poor environmental circumstances, that children don't grow very well. And the corollary of that is that then those people as adults have very poor health throughout life and maybe require additional support or the lifespan, and or succumb to other diseases much earlier than they would otherwise, cancers, diabetes, heart disease, etc. So assessing childhood growth is very important, not just from that individual child, but from the whole population, really.
Now, we're all familiar with being put up against the doorpost and having our
yes, absolutely, yeah, absolutely, that's right.
Pen. Do we measure our kids enough, do you think?
I think it depends where you are in the world. I think some countries have got it well organised. In countries, for instance, the States or mainland Europe, where there are individual primary care paediatricians. It's quite normal for children to be weighed and measured, and baby clinics. Some countries, as I'd include the UK, we're very poor at measuring children. They will be weighed in the first few months of life, and after that it's only very occasional monitoring that takes place, which therefore it is a problem with picking up problems at an earlier stage, but also it's then not so good to be able to have an idea of what's going on in the population, really.
Now, I can see this as beneficial in picking out issues with individuals.
Yeah.
How do you see it translating over to public policy? I mean, does it have a relevance there?
Well, there's two areas there, really. One is with regard to getting optimal physical growth, because you actually want not children to grow as well as possible, and if they are undergrown, you want them to catch up in a steady way so they don't then get other sort of ill health later on in life. And the other way is to prevent overgrowth, because it's very clear now from lots of research that if there's excessive growth and development of obesity earlier on, then those babies, those children are obese children, they become obese adolescents, obese people, and therefore they have poor health long term. And the risks of type 2 diabetes, cardiovascular disease, and also other things, just simple wearing out of joints, and also having to redesign buses, trains, transport just for bigger people is more of a challenge. So it really needs to be tackled earlier on.
Yeah. And you brought up obesity there. We are told constantly that there's an epidemic of childhood obesity in the developed countries, particularly US, UK. Would you agree with that?
In general, there is, yes. I think there has been a change over the last generation due to the increase in consumption of energy-dense foods and also the lack of activity. I think, yes, there's absolutely clear that that's the case. I think there are measures afoot to try and stem that. There are reports now that that epidemic as such is not ever increasing. It's plateaued, but nevertheless, the proportion of children who are overweight or obese is too high.
Now, obviously, imitation is the sincerest form of flattery. The growth curves that you've developed and your teams have developed at places like UCL are now being taken over by the veterinary profession, looking at puppy growth. Would you see that as a positive move, or would you be concerned that that's too simplistic a translation?
I think any form of assessment of growth and trying to work out how you should care for whether it's a child or a pet is really important. I think actually is a wonderful development to have puppy growth curves, and I hope there will be others developing as well, so that owners can actually take ownership of the well-being of their dog, particularly if they're interested in how to ensure better nutrition. And we go to pet food shops, supermarkets, and there's a whole realm of different sort of diets to choose from, and how do they do that, and how they're going to monitor what is actually best, really. So no, I think it's very positive, and I think we're quite flattered really to see how they actually match, or how they seem to be worked in the same way, and how they're produced to actually be very similar, so that people can actually move from one set of growth to understand how to use child growth standards compared now with puppy growth standards, and that they actually look very similar. And actually, looking size for size, humans and dogs in that first year of life are not too dissimilar actually.